Traumatic brain injury is a common occurrence in the United States and is the leading cause of trauma-related deaths among people younger than 45 years of age. Males are 1.5 times as likely as females to sustain a traumatic brain injury. The highest incidences of traumatic brain injury occur in children younger than 4 years of age and in people ages 15 to 19 years. Causes of traumatic brain injury include falls, motor vehicle accidents, assault, and injuries causing a blow to the head. Traumatic injury can result in damage to the skull, meninges, and brain, including neuronal pathways, cranial nerves, and intracranial vessels. The extent of traumatic brain injury can range from mild to severe. Injuries may be open or closed. With an open injury, the scalp is torn or a fracture extends into the sinuses or middle ear. A closed traumatic brain injury occurs when there is no break in the scalp. Survival after traumatic brain injury is dependent on prompt emergency treatment and focused management of primary and secondary injuries. Primary brain injury is a direct injury that occurs to the brain from an impact. Different types of primary brain injury include concussion, contusion, penetrating injuries, and diffuse axonal injury. Secondary brain injury occurs as a consequence of the initial trauma and is characterized by an inflammatory response and release of cytokines from macrophages that cause increased vascular permeability of the blood vessel wall, leading to vasogenic cerebral edema. Factors that contribute to secondary brain injury include hypoxia, infection, decreased cerebral perfusion, and/or fluid and electrolyte imbalances. Assessment of a patient with a traumatic brain injury includes utilizing the Glasgow Coma Scale, along with a thorough neurological examination and assessing airway and oxygenation status. The nurse should also monitor the patient's intracranial pressure, cerebral perfusion pressure, and hemodynamics, as well as laboratory and diagnostic reports. Possible nursing diagnoses for traumatic brain injury include ineffective cerebral tissue perfusion, acute confusion, and ineffective breathing pattern. The nurse should plan nursing interventions based on the nursing diagnosis. Possible nursing intervention that should be implemented for a patient with traumatic brain injury include administering prescribed medications, monitoring vital signs, maintaining the airway, providing oxygenation, maintaining cerebral perfusion, reducing intracranial pressure, reducing the incidence of infection, preventing fluid and electrolyte imbalances, avoiding nutritional deficits, and preventing secondary traumatic brain injury. The nurse should continually evaluate nursing intervention to ensure that it is effective and meets treatment goals.